The mechanism of injury for this ankle dislocation was landing forcefully on an unstable ankle in extreme eversion. As you can see in the video, the athlete was attempting to avoid a tackle and landed full weight bearing on his left ankle. Upon landing, the ankle immediately dislocated. The ankle joint is made up of the tibia, fibula, and talus. The distal tib-fib joint creates the concave surface over the convex talus. During an ankle dislocation, there is a severe displacement between the tibia and the talus. The most common type of dislocation is a posterior dislocation. This occurs when the talus moves in a posterior direction as compared to the tibia. When that occurs, the connective tissue surrounding the joint is stretched, therefore creating even more instability in the ankle.
The short-term goals for the patient are to decrease pain, decrease swelling, increase range of motion, and increase strength. The long-term goals are to restore full range of motion, restore strength, and return to play pain-free.
After the dislocation is reduced and the athlete is sent for x-rays, they are then fitted for a boot and immobilized with crutches for a minimum of 2 to 3 weeks. During this time, they are completely non-weight bearing on the injured ankle. The athlete is instructed to take NSAIDs to manage pain, along with elevation and ice to help with decrease of swelling. The entire rehab process is based off the concept of DAPRE. Changes may be made, if necessary, to accommodate the athlete.
Phase 1 is initial management of the acute inflammatory response. Therefore, it is essential to minimize swelling with elevation and decrease muscle spasm with ice. This should be done for a duration of 20 minutes 2 to 3 times a day. We also want to maintain the athlete's conditioning and increase heart rate using the upper body ergometer. The athlete should start with the UBE at no resistance and complete the exercise for 5 minutes.
To initiate range of motion, the athlete is instructed to use the BAPS board in a seated position. From here, the athlete will touch the front of the board to the ground and then touch the back of the board to the ground only. This exercise is to mimic plantar and dorsiflexion. Once completed, the athlete is then instructed to do the opposite by touching each side of the board to the ground for pronation and supination. It is important to make sure the athlete stabilizes above the knee to ensure that the range of motion is coming strictly from the ankle joint. This should be completed 3 sets of 10 in each direction. Next, the athlete will complete a 4-way TheraBand exercises for dorsiflexion, plantar flexion, inversion, and eversion. The athlete should perform the movements in a slow and controlled manner while the clinician stabilizes above the ankle. Each direction should be performed 10 reps for 3 sets. The next exercise the athlete can complete is the bird dogs. Instruct the athlete to start on their hands and knees with their spine in a neutral position. The athlete should tighten the core and back muscles and slowly lift one arm and the opposite leg off the table while maintaining a tight core and neutral spine. They should lift their arm and leg to the height of their torso and then lower back to the table. This exercise should be done 3 sets of 10 reps.
In Phase 3, the athlete will perform standing calf raises in order to start strengthening the muscles around the joint capsule. The athlete will use a table for stabilization and complete 2 sets of 25. This exercise should be progressed from a bilateral stance to a unilateral stance. Another exercise the athlete will do are step-ups. The athlete will be asked to step up and down using both the good foot and the bad foot first. Then they will perform the same thing but in a lateral direction. The athlete should do 3 sets of 25, both up, down, and laterally. In order to facilitate proprioception, a Romberg test will be performed. On a stable surface, the athlete with their eyes open will stand on 2 feet, then 1 foot, and then they will progress to a tandem stance. Each stance will be held for 30 seconds. The athlete will then be asked to do the Romberg test again, but with their eyes closed. During Phase 4, the athlete will perform functional exercises to assess their ability to return to play. The athlete will perform Bosu ball squats by having the ball side on the ground. The athlete will be asked to perform 3 sets of 8 while keeping proper squat form. The athlete will then progress to 4 square plyometrics. First, starting on 2 feet, the athlete will jump from square to square, keeping a pattern chosen by the clinician. They will then progress to just jumping with the involved leg, keeping the same pattern. Then the exercise will be progressed to unknown. For this, the athlete will still be jumping with just the involved side, and the clinician will instruct the athlete as to which box to jump to. To facilitate strength and proprioception further, the athlete will be asked to stand on the involved side on an Eric's pad facing the clinician. The clinician will then toss a ball at the athlete in all directions. This should be done 25 times or as tolerated.